Dr. Annie Liu is a dermatologist practicing in Toronto with a dual board certification in Canada and the US. After graduating medical school from the University of Toronto, she then completed her postgraduate dermatology education at the University of Toronto, where she served as the chief resident. She has specialty training in procedural and oncological dermatology and has authored numerous peer-reviewed publications in international medical journals, including JAMA, JAD, JDD, and the Journal of Dermatological Surgery. Dr. Liu has also received several academic distinctions, including Best Paper Award from the Canadian Laser Aesthetic Surgery Society, American Society of Dermatological Surgery Mentorship Award, and the Women's Dermatological Society Mentorship Award. She was also awarded the CDA Frederick Kells Research Award, which allowed her to engage in research on advanced melanoma at L'Hôpital Saint-Louis in Paris, France. While receiving advanced training outside of Canada, she was inspired by the modernized aspects of other healthcare systems. In 2020, she co-founded DermCafé, Canada's first digital dermatology center. With less than 700 dermatologists serving the entire Canadian population, virtual care represents a unique option for accessible and equitable care in a particularly underserved system. She is excited for the growing opportunities and advancements to care that virtual dermatology can offer Canadians.
Thank you so much for that introduction. That was very humbling to hear. My name is Annie, and I'm very excited today to be presenting on virtual dermatology. So today we're sort of going to cover three things. What exactly is virtual dermatology? What is DermCafé? And then I'd like to talk about skin cancers as well to end off. So just to start off on a lighter note, as sort of coming from more of a just a more comical start. You know, in my training and my experience outside of Canada, I did see how different sometimes care was. There's always benefits and disadvantages to every system, but I did see how in many other systems pre-COVID, there already existed a lot of virtual care, not only in dermatology, but other specialties as well. But as a dermatologist, I had experience in dermatology outside of Canada. And it was fascinating to see how accepted and integrated virtual care was already in places like Europe and the US pre-COVID. So like in 2018, 2019. The US has a very different system, but in many of their big cities, you can easily see a dermatologist in 2 weeks, like no trouble at all. And yet they still had a lot of virtual programs. These are just some images of virtual programs that they've had for many, many years. And I just thought it was inspiring because I think this is something that definitely could help our Canadian system if implemented correctly. So these are just some examples. And then this is a map, sorry for the blurriness, taken from an article, a Canadian article written in 2018. And all the pins show where there are virtual dermatology programs in the world in 2018. So this has nothing to do with COVID, it's about access. And you can see there's a lot, like many places around the world, a lot in Africa, and there's none in Canada. So, you know, I think one of the silver linings of COVID, which was a terrible, terrible pandemic, is that it has forced Canada to look at virtual care. And on that note, just on a comical sort of side of things, here in Canada, I do find that sometimes we may not be the most modern system. You know, our wait times are just, you know, I think they're ridiculous, and it really impacts care. My colleagues in Ottawa tell me that their patients are waiting for 1 year to see a dermatologist. That has like incredible impact on a patient, emotionally, physically, medically. And, you know, it's all we know is how to wait. You wait for the appointment for the family doctor, you wait for a referral, you wait for your appointment, you wait in the waiting room. And it's so understandable why people are very frustrated. And I could go on and on about this, but there's so much data showing how much the wait times are. Of course, it varies province to province, but there's I don't see any acceptable wait times here. So these numbers here are how long people are waiting from like after having seen their family doctor to see a specialist. Even the best wait times of 16 weeks, that's 4 months. And if you have like a concerning symptom, a skin cancer just lying there, that's not acceptable, I think. So I think what we have in Canada in terms of dermatology especially is an inaccessibility crisis. And of course this varies. So you'll hear people say that the wait time is 4 weeks in Toronto. I work in Toronto. That's true only in certain pockets. In some places in the GTA, like the Greater Toronto area, it's a 3-month wait time. And then in our capital city of Ottawa, it's a 1-year wait time. You know, I almost think like, what is the point of having a wait time that long? Like, if you're going to wait that long, you know, conditions will progress, diseases progress. It's unacceptable. And not to mention that most Canadian cities don't even have a dermatologist in their city. Like, there's just zero option that's accessible. They maybe have to take a flight, drive 6 hours. And we know that patients living on the border, maybe not during COVID, but living on the border are already going across to the US to get dermatology care because there's just no other option. So I just want to recap that. Our capital city, Ottawa, has wait times of 1 year to see a dermatologist. And this is sort of a rhetorical question. You can sort of think about it yourself, but let's say you had a concerning skin symptom, and it doesn't matter what it is, whether it's cancer or not. You know, you're worried, you don't know what it is. Maybe it's a really red rash that's really bothersome and wakes you up at night. Maybe it's just like a pimple that's so embarrassing and you have to go on interviews and do your job every day and it really affects you. Or maybe you're worried about skin cancer. How long would you want to wait to speak to a medical professional, to get some sort of plan going, to know what you have? You know, I ideally, like, I wouldn't want to wait at all, but I wouldn't even want to wait 1 month, especially if it's something like skin cancer that I'm worried about and that can grow and spread. So I love the Canadian healthcare system. It's obviously, you know, the moral way to have it, universal access, but I sort of think without access to doctors, what is even the value of universal healthcare? So I think this is a huge challenge that it'd be great if we all sort of work together to improve over time. So virtual care may be a partial solution in improving access challenges. So what is virtual care? There's so many different types out there, variations on how it's carried out, but essentially it's where patients connect with doctors using modern technology. And that seems simple enough, so what? It's actually quite significant in what it means for not only you, your family, but the whole system. There's 2 pieces of significance. The first is that it eliminates barriers. So it doesn't matter where you are, how busy you are, how inaccessible your schedule is, what time of day it is, you can access care. You don't have to live right beside the dermatologist. You can be 300 miles away. You can have a busy schedule as a lawyer, and you know, normally you wouldn't have time. You'd have to take the day off work, but now you can access a dermatologist like on your lunch break. So it eliminates those physical and time-related barriers, and in a way, more importantly, it provides equitable care. Because like I had mentioned before, certain cities have better access than other cities, like Toronto versus Northern Ontario. Well, now it doesn't matter where you live, whether you live downtown Toronto, like literally, like I said, right beside the dermatologist, or if you live in Northern Ontario, all you need is an electronic device and probably internet access to connect with the dermatologist. So like endless examples of how this can impact patients' access. For example, a mother named Sarah has 2 young children. She has a rash herself, or maybe one of the children has a skin concern. She can't find time to take off to book, you know, half a day or a whole day to see the dermatologist, drive over there, wait in the waiting room. It's not possible. But now if she can manage to book an appointment virtually, connect with the doctor over video call, you know, you don't need to take time off work. You don't need to find a babysitter. Or as another example, Tim, who lives in Kitchener, Ontario, who, if there's no dermatologist in that city, it doesn't matter. They can now connect with the dermatologist who lives in another city. And what's sort of special about dermatology and virtual care? So dermatology is all about making diagnoses by looking at the skin. So we visually inspect it, we look at it. We're trained to be able to analyze how a rash, a lesion, a mole, a bump looks, and we can tell sometimes what the diagnosis is. So that's why it's especially more amenable to virtual care, as opposed to other types of medicine like heart doctors, cardiology, where they have to use a stethoscope to listen to your heart. So that can't be done yet through an electronic means. But because we mostly rely on visual inspection, it makes it much easier for us to do virtual care through mostly analyzing photos of patient skin. So now the next question is, can skin concerns be treated through photos? And the answer is it does depend, but overall, yes. So there's some concerns that can be entirely treated virtually via photos for the inspection, and like connecting with the patient, you can obviously video call is nice to be able to see each other. We never inspect on the video because that's way too blurry. But again, the inspection is on a photo that the patient sends that we can look at. So some conditions can entirely be treated like this. These are some examples: acne, rosacea, other facial rashes, discoloration on the face, various local contact dermatitis, or eczema, psoriasis, rashes that are sort of localized to one limb, one hand, and basically can be easily photographed. There's been scientific studies that prove that the outcomes for these conditions when cared for virtually versus in person are the same. It's not worse, it's not better. Arguably, the whole experience could be better because you're not waiting long, things like that. But these conditions can fully be treated virtually. And then other conditions can't fully be treated virtually, but can be expedited and treated in a better fashion in collaboration with a provider in person. So everything else, basically, skin cancers, rashes, wounds. And in these situations, it means, for example, if you're in a city and the wait times to see a dermatologist are too long, which is every city in Canada, I think, you go to your family doctor, maybe you have a mole, and they're not sure if they should take a sample of it or they should watch it or what to think about it. They could refer you to a dermatologist, and maybe it takes a year in your city to see one. So in the meantime, your doctor can take a standardized photo of that rash, or sorry, that mole or that concern, send it to a dermatologist who can look at it and provide your doctor or your nurse practitioner with advice. What are the next steps? If a sample should be taken, where should it be taken? And really push along care, because there's really like no faster option, and doing that is so much better than waiting one whole year. So different skin concerns can be treated in different ways virtually. So that sort of brings me to what is DermCafé. As you've probably heard, it's basically a virtual or digital dermatology clinic that I helped to start. We started in January 2020 before the pandemic, so it was a complete coincidence. We started because we think this is the future of dermatology, not for every part, but a large part of it. And the pandemic was a coincidence that came along. So what are we? As I said, we're a rapid access digital dermatology center. So we're entirely electronic. So that means we can't like treat everything. We can't like do skin cancer surgeries online. But there are a lot of ways we can help. And we're Medicare based. So we're OHIP covered, MSP covered in BC, AHS covered in Alberta. Because access is our core value. And we know that without, if you put some sort of financial barrier, that makes no sense. People can't access it then. So we do have 3 missions, which might be kind of obvious. Obviously, improve access, modernize care, and really refocus onto the patient, make the experience more patient-focused, as we find sometimes in Canadian care, things are a bit rushed, and I'll talk about that a little later. All aspects of our care are conducted on a custom-built platform, a software, and it's obviously what's called FAAD compliant, meaning it follows all the privacy laws of Canada. We do find sometimes people are very hesitant and they're worried about the privacy aspect. I mean, put it this way, no one wants any privacy risk. So it did take a long time for us to build something that really follows all the rules, and we take privacy very seriously. So there's two ways that we help patients. The first way is through what's called just virtual visits. So think of when you see a dermatologist or doctor in person, it's exactly like that, except you connect with the doctor through a video call. And our wait times for this visit are less than 1 week. So this does require that you get a referral, just like any other visit, for it to be Medicare covered. And this is our sort of largest service. And there's a wide variety of people who access this kind of service. But one example is, this is all sort of anonymized data. This is not anyone's real name, but a mother has a 3-year-old daughter with eczema that is on her arms and is not doing well. Her family doctor gave her some creams and it's not totally controlling it. It's so uncomfortable for the little baby. It wakes the baby up at night and the whole family. The local dermatologist has a wait time of 6 months, and that's just unfathomable to imagine having to wait and deal with that rash, the whole family, every night for 6 months. So they got referred to DermCafé, were seen in 1 week, were prescribed something new, and the eczema is under control. No time needed off work, no babysitter needed. The mother connected with our doctors just from her couch in her living room. Now, that's the first service. The second service is what's called e-consults. This is where your doctor or your nurse practitioner can send our dermatologist an electronic question. So for example, if you have like a mole that you're not sure about, you go to your doctor and they are not sure what the next step is. Maybe they want to take a sample, they don't know where to take it, they just have questions. And as usual, the dermatologist is not very accessible, whether that's a 6-month wait, a 1-year wait, or there's just none available in the city. So instead of sort of just not doing anything or waiting a long time, that doctor or nurse practitioner can, on our website, it's like a form that a 10-year-old could fill out, just fill in a secure form, send basically a photo of that concern, skin concern, along with just information about it to our doctors. And they will get a response within 1 day from our dermatologist with advice. So sometimes the advice is, yes, you need to biopsy, or no, it's okay to watch, or anything else. And this is important collaborative work because as a dermatologist, we cannot fully care for moles or skin checks online because it's just not practical. Sometimes we need to take a sample. Sometimes we need to fill your lymph nodes. But in working together with local doctors, we can provide advice and the doctors can carry out in-person actions, whether that's taking a sample, feeling the lymph nodes, doing anything else. And we've been doing a great service in partnership with Amgen for patients who are on what's called EGFR inhibitors. Sometimes it's chemotherapy used for things like colon cancers. Those patients can get side effects on their skin, various rashes. And when that happens, sometimes doctors just want advice from dermatologists. So our dermatologists often provide advice this way, and their patients can get timely care. So that's the second way we help, electronic e-consults between doctors and nurse practitioners. And they get an answer within 1 day. So for the patient point of view, how does it sort of work? If you're sort of wondering, how do I get started? So, this second service, it's leave it up to your doctor. Essentially, they just go to our one website and fill in the form. It's that easy. But for patients, how do you get started? It's also really easy. This is what happens. So first, you just submit your information. You go to our website. It's called dermcafecanada.com. dermcafecanada.com. There's like large book now buttons everywhere. So you just click those buttons and you submit your info first. Again, this is a secure web page. No one can access your information. It is secure. We ask for just general symptom information. When did your skin concern start? How is it bothering you? Things like that. It takes about 2 minutes to fill in that form. And included in that form is where you submit your photos. And you'll see when you submit photos, there's some tips we give you on how to take good photos. And then you just book your appointment. So the next page you'll see is just a list of calendars and a list of doctors' names. So you can choose the exact doctor you want and the exact time and date you want. Because in our mind, this isn't something that needs, a human in between to facilitate. It's totally up to you. You should be able to control exactly when you see the doctor and which doctor you see. And it's just a simple calendar on the form that you choose your time. And then the visit happens. It does sort of look like this, whether it's on your phone or your tablet or your laptop, it happens through a video call. So it's all very intuitive. It's something that doesn't really need explanation, but when you go through it, you'll see that you don't need to be walked through it. Everything's automatic. So you'll get a reminder through text and email of your appointment times. There's no downloading of an app, installing anything. You keep getting text and email reminders. And in those reminders, there's one simple link that says, click here to join your doctor's waiting room. So no skill is required. You just need an electronic device and internet connection. And you just click that link and it opens up to the video call with your doctor. So it sort of looks like this. And then you have that video call, you chat with them. And then when the visit is over, you'll get another email with a link to what's called a secure portal. Everything is in that portal. The name of your diagnosis, the treatment plan your doctor wrote out for you, the prescription as well, and you just choose the pharmacy to send your prescription to, because it's up to you, right? You can choose whatever pharmacy you want. If there's blood work forms, it will be there. If there's handouts, such as the Melanoma Network of Canada handouts, it will be there. And then you can book your next appointment on there. Literally everything to do with your visit is on your secure online portal. And it's sort of for you to keep as a record too. A lot of times we hear from patients, or when we know our families or our acquaintances see doctors, they waited so long for an appointment, and then they finish the appointment and you ask them, oh, what did the doctor say? What was the diagnosis? And a lot of times the person just says, I forgot. I don't remember what the name of the condition was. And I don't remember the 4 things they told me to do. And how can you, when visits are sometimes so rushed and people are told to do 1, 2, 3, and then, you don't have any record of it. So that's why we made this portal. It's really to give you the convenience and transparency of the whole experience. So that's really how it works. As mentioned, you do need a referral from your doctor. So you can see your own family doctor to get that referral, and you just wait for an email to your email account saying your doctor referred you here, click here to book, and it will take you to this first step. Or if you don't have a family doctor, which truly a lot of Canadians don't, we on DermCafé have family doctors that can see you first and then refer you to our dermatologist. And to do that, you just book first with our family doctor. They're usually available within the next 1 or 2 days. So that is how that works. And I know a lot of you may be wondering, how is this possible? We get a lot of skepticism. A lot of people ask, is there a fee for this service? Because it's just so different and new. And yeah, it seems kind of unbelievable, I guess, that there's such long wait times elsewhere and our wait times are less than 1 week. So how is that possible? There's no deception here. It's because of 2 main factors. The first is that a regular clinic is a bit different. It has a limit to how many patients can possibly be seen there because it has 6 rooms or 5 rooms. So there's a limit for sure. With online platform, there is no limit. There can be 100, there can be 1,000,000 patients. And there's also no limit on how many doctors can join. So that's why we do intend to keep growing our team, and therefore we can continue to see more patients. We also, a big part of this is we work together very closely with our fantastic family physician colleagues. So as I mentioned at DermCafé, there are family doctors working with the dermatologist too. And sometimes when the wait times go longer, the family doctors can see particular cases sort of under in collaboration with the dermatologist. So if the patients have questions that can be answered by the family doctor, or counseling needs, or quick follow-up appointments, the family doctors can see those patients, and that way the dermatologist can keep seeing the patients on the waiting list and keep the lines shorter. So it's teamwork, and it's an unlimited electronic platform that allows us to have such great wait times. So I know I've talked so much about this. I sort of just wanted to end off with this quick concept, because virtual care is so different and new, and it may be hard to really appreciate, like, what's the big deal about this? There's this concept of high touch versus high tech. And high touch is seen in industries where there's a lot of personal attention and service, such as law, like real estate, or truly medicine should be high touch. And high tech doesn't involve so much personal service, but uses a lot of advanced technology. So there's a lot of automation. It's very efficient. It uses, artificial intelligence. And I would say, in general, that there is not too much high tech in Canadian medical systems, which I don't think is a good thing, because a lot of the processes that are part of our systems are very manual heavy, and that affects everything. That affects the attention the doctor can give you. That affects the wait times, the overall system efficiencies. We still use fax machines for some reason. So what DermCafé is hoping to be, and I think that's what a lot of virtual care really has the potential to be, is high touch powered by high tech. We remove all the inefficiencies, all the manual processes. People don't wait long because of some sort of manual limitation of a receptionist only being able to speak so quickly or take so many calls. Everything is automatic. Robots don't make mistakes. So anything that can be automated will be. And overall, what that does is it shifts the doctor's attentions more towards the patient. So that was one of the goals of DermCafé, to really refocus care on the patient. We do find sometimes, just because in Canadian systems everything's so under-resourced, we don't always spend as much time with the patient as we would like to, whether that's a quick visit or a 2-minute phone call. So at DermCafé, we really try to be efficient so that we can just spend those extra minutes with the patient, listening, explaining things, connecting with them. So yeah, that's sort of a little bit how we try to transform things. And so obviously this is an exaggeration, but in traditional medicine, a lot of the frustrations are seen as such. So before the visit, of course you're upset. You have to wait in a year or 8 months. You have to take a day off work and school for this. And then you still have to commute to the office and still have to wait in the waiting room, sometimes for an hour. And then if you want to reschedule, good luck. You got to hold on the phone for 30 minutes. You can't get through. During the visit, maybe it was so short. You waited 6 months, then 2 hours in the waiting room, only to speak to the doctor for 2 minutes. And then hopefully the doctor was nice, so that's good. But then after the visit, there's no record of it. You forgot what the diagnosis was, and you still have to wait at the pharmacy. So not that we're like the ultimate best experience, we're always trying to improve ourselves, but this is what we're trying to really aim to be. So before the visit, there's really minimal wait. It's just a week. You don't have to take time off anything. You can connect with the doctor on your lunch break at home. And you're in control of the schedule. You want to rebook? Rebook. You want to cancel? Cancel. You want to change the doctor? You can do that with a few clicks. During the visit, this is where we do try to be a bit different. Like everything is focused on the patient. Everything's automated, so there's not as much paperwork, honestly, on the doctor's end. And that is one of our missions, to really focus on you on the visit. And truly, we actually do tend to stay more on time. I'm not sure how to exactly explain it, but I think it's really the simplicity of the electronic platform, that there isn't so much like someone checking you in, someone cleaning the rooms, pulling down the bed sheet, calling you into the room. None of that happens. It's just a simple click and you connect. So the doctors do tend to stay literally on time. And then after the visit, you have a record of everything that happened, the name of your diagnosis, a handout right there, the prescription. You can control, do you want the prescription delivered or not? We also partner with a pharmacy that delivers medications for free to your house. So from the first step to the last step, you could do entirely in your living room and have your medication delivered for free, usually same or next day. So that's what we're really aiming to be. I think virtual care has that potential. So that was my talk on virtual care. Hopefully it explains a lot for you. It's definitely new for Canada. I think it has so much potential, especially because we're already underserviced. And now on top of that, COVID has definitely worsened things. So I think one important thing is to remember that we are all in this together, and what our neighbors do, our friends do, affects us. So if we can sort of move skin conditions that don't need to be seen in person online, we can save those visits for people who do need in-person visits, such as skin checks, mole checks, skin cancer surgeries, because that you can't do online, right? So I think there's a lot of potential for the Canadian healthcare system. So I'm just going to move into my last portion, which is just a quick talk on skin cancers. I couldn't not talk about this since I'm a dermatologist. So this might be a bit boring for some of you, but it's just so important, I find, to drive home these messages and spread awareness about this, even if it's so basic. Because whenever you're talking about cancers, especially things like melanoma, prevention education is key. So there's three main types of cancers: basal cell carcinomas, squamous cell carcinomas, and melanomas. And they all have sort of different flavors and characteristics. And I've included a few photos here, but sort of the difficult thing is, I guess ultimately, as a patient, you may not be able to tell, and that's okay. That's what we do 9+ years of training for. So we're here for you. Hopefully the wait time is not too long, because that almost defeats the purpose, but I'm going to try and talk about these cancers to leave you with some tips and pearls on how to differentiate them and what to look for. So basal cell is definitely the least dangerous out of all of them, but it's still a cancer, so it's something that should be cared for in a timely fashion. And none of this is an absolute. There have been basal cells that don't look like basal cells at all, but I'm just saying overall, these are classically what they look like. So basal cells usually look sort of pearly. And if you can see these photos, like it looks a little bit shiny, usually, but then there's types that don't. So the classic appearance is like a shiny bump, and it can have some blood vessels on it. The skin can sort of open up sometimes. It can bleed a little, but think shiny bump. And they do occur on sun-exposed areas because it is the UV radiation that's causing them. So sometimes this is very confusing because it can look similar to a mole, because moles can sometimes look like a shiny bump too. And whenever unsure, it's definitely time to see a doctor. Its cousins, squamous cell carcinomas, I sort of think as the more dangerous cousin. It's not as truly dangerous as a melanoma, but it is a little more dangerous than basal cell. These are not as, gentle looking. They're often really hard, really bumpy, and they can have some crusting or flaking on them. And they're not usually pearly. They usually look a little red or brown. And they can behave a little more aggressively, so they can bleed more easily. The skin can usually open up. And for sure, as with all cancers, definitely see a doctor. And then melanoma is the big one. And I say that because it has the potential to travel in your body. So that's what's so dangerous about it. And these ones can really fool even doctors sometimes. But, classically, you think of a mole that just looks so funny in any way, whether it's the color, the shape, the size, the borders. And it can arise from an existing mole, or it can come from a totally new, like it can develop on its own from random clear new skin. So the key is just getting it yourself seen as soon as possible, because time is health. And it really can make the biggest difference between, seeing you like within 1 month versus 1 year. So I'm going to go over a little bit more about the melanomas, but these are the main types of skin cancers and how they sort of differ. And so I cannot say this enough, but it's so important to detect and prevent for you, obviously, your own health, but like thinking beyond that, even like system-wide, it's, it's so much more difficult to treat cancers that are later stage. There's so much more to the process. And then the system in terms of like finances costs so much more. So for everyone, we should really be focusing on prevention and detection. So spread the word about all these messages. The biggest thing is what's called ABCDEs of melanoma. And this is an acronym that can help you remember signs to detect possible skin cancer. So A stands for asymmetry, basically anything that's not symmetrical. So if you can take a ruler and like divide it any way and it still looks symmetrical on both sides, then that's symmetrical. But if you like this one, I can't quite draw, like with a ruler, I can't really draw down any orientation and still make it look the same on both sides. So that's a big red flag. B is border. So basically any border that's funky. This border of the border of this picture is nice, right? It's round, it's totally uniform. It's not what I would call funky. This is definitely, there's something weird going on. It's not uniform. It's jagged and it looks odd. So that's another sign. C is for color. So basically odd colors. Something that's totally uniform, totally brown throughout, doesn't have any different colors, especially when you're seeing like white, dark black, light brown all together, that's not a good sign. And then diameter for D. So we say if it's larger than the pencil eraser, which is about 6 millimeters, that's a little more concerning. And then the biggest thing is E, which stands for evolution or change. So if it's changing in any way, it's growing quickly, the colors are changing, the borders are changing. I'm sort of repeating things from before, but if it's just becoming different over time, that's a sign you should just see a doctor. And, I guess to get into all the details, it really does, I guess it's why we do 9 years of training, that it's so rigorous and we see different cases. So when you're really not sure, it's not up to you. It's our responsibility and we're here for you. So please do see the doctor. So ABCDEs. And then, of course, like I said, seeing the doctor is so important, not just once, but on a regular basis. And that's where, I say that, it's easy for me to say, but of course it's hard to access care a lot of the times, which goes back to everything I just said. So we're at DermCafé, we're all trying to make the system better so that care can be more appropriate and maybe spots can open up more for people who need regular checks. And maybe if you need a check every 6 months, every 1 year, it won't be that difficult for you if things like acne are being seen online. And then sunscreen all year round, SPF 30 at minimum. I find people don't use sunscreen enough ever. They think it's only for summer. They think it's fine to put on once a day. When you're outdoors, it should be every 2 hours and reapplying every time you're in water. But sunscreen's not enough, as mentioned in the beginning. It really needs to be combined with protective clothing. So like all the way down to the hands, large broad rim hats, long sleeve pants and shirts. Personally, when I drive, I use sun protective gloves because that's something you think about. The sun rays really penetrate through the car windows and they can really affect the hands. And then avoiding peak hours. So 11 to 3, I personally try to avoid 11 to 5, but we all have to live our lives. So that's why the combination of sunscreen, protective clothing, and avoiding peak hours allows you to still live your lives still have fun, still be active outdoors, but not compromise the safety of your skin. And then there's like cool new options for surveying and detecting skin cancers. There's something called mole mapping, which is popping up more and more in Canada. It's basically offered at certain in-person clinics where they have professional mole-oriented photography for your moles. So you can go in regularly and get your moles photographed in a systematic way. They keep it in there on record. And that way, when you come for checkups, oh, I think my screen disappeared. Okay, I think everything's okay. I'll just continue unless someone speaks up. But that way, when you come for checkups, the doctor can really literally compare to how the moles were like previously. Because as we mentioned, evolving is the most important sign for skin cancer. And obviously, to be honest, a lot of doctors, like myself included, and probably every doctor, can't exactly remember how each mole exactly looked 6 months ago or 2 years ago. So mole mapping is definitely an interesting and very helpful option. Unfortunately, to my knowledge, it's not covered in any provincial Medicare plan. My hope is that it would be in future, but to my knowledge, this is something that's available out of pocket right now. And just to end off, I know I've taken a lot of your time on a beautiful evening, but just wanted to touch on the fact that for those of you who are on or know people on immunotherapy for things like metastatic melanoma, there's a lot of skin concerns that can come up when you're on these medications. And really commonly for all of these chemotherapies, your skin can become sensitive to the sun, you can feel really itchy, and you can get various rashes. But on top of that, certain medications can give very unique side effects. So for those who have experience with BRAF inhibitors like vemurafenib, you can get acne-like rashes that definitely have really good medications for treatment. So make sure you speak to a doctor about it. For those on MEK inhibitors, you can get interesting like hair texture changes as well as acne-like rashes. And then for things like pembrolizumab or ipilimumab, the immunomodulator type chemotherapies, you can get more interesting immune-related skin changes. So things like discoloration of the skin, hair loss, and other like bumps and rashes. So not to worry too much if that happens. It's certainly something dermatologists are trained on, and to please seek care as soon as possible. So just to summarize, I think it's kind of obvious, but Canadian dermatology is reaching unacceptable levels of inaccessibility. And that virtual care can be kind of a common sense solution to many of these challenges. DermCafé is an OHIP, MSP, AHS covered virtual dermatology center. We're hoping to become national at some point, but we're starting off with these 3 provinces. For patient virtual visits, you'll be seen in just under a week time, and we can treat certain conditions, sort of things that are easily photographed. And then all other conditions we can really provide collaborative care for in collaboration with your own nurse practitioner or family doctor. And they get a response within 1 day from our dermatologist. And just check out our website if you have questions or you want to get started at dermcafecanada.com. But most importantly, skin cancer is something that everyone in dermatology is very hypervigilant about. It arguably can have the most impact on a patient's life out of many skin conditions. And I think anything we can do to help skin cancers be treated, be detected, and to prevent them, we should do. Whether that's campaigning, social awareness, campaigning, or by making the system a bit more accessible so that those waiting for care don't have to wait any longer than they need to. It was an honor to be able to speak here. I hope that was helpful.